her some air! Give her some air!
Rescue on its way. Yeah. All right, stay up here.
Okay.
All right.
I can't believe it.
Please.
I was right there as that fan collapsed as the word guilty was chanted as the people outside court found out that Dr. Conrad Murray had been found guilty in the involuntary manslaughter case against him. I want to go to Dr. Nat Strand, anesthesiologist. A lot of this case was about anesthesia, the improper use of propofol, which is a surgical knockout drug that is supposed to be used only in surgery. What did you take away from the guilty verdict in terms of how it's going to impact the medical profession?
Well, first of all, let me just say that I think the guilty verdict was absolutely the right verdict. I think this case is sad in a lot of ways, but one cannot escape the fact that Dr. Murray acted so far below the standard of care. His behavior really was reckless. So I think this sends a good message to the medical community that we do owe our patients that relationship of trust, that we owe them to be in control of ourselves. We owe them to be informed and prudent and educated and in control. I think here Dr. Murray wasn't in control. He was intoxicated by Michael Jackson's fame and by the money, and he made poor decisions.
Marcia Clark, do you think doctors who are loose with the scripts are going to be nervous tonight about what they can do and get away with?
Oh, I think so. I do think that if there's one thing that this case achieved, it is putting those doctors on notice. Watch out. But you know, as I was telling you during the break, I wish I had a doctor like that. Mine won't give me aspirin. So I don't know who these doctors are, and I do believe that they do accommodate celebrities.
They're out there. They're out there. I've talked to them. As a person in recovery, I've talked to a lot of people who are my friends in recovery who have doctor shopped, and they are out there. You are going to good doctors, but there are doctors out there who want patients who will, Brian Oxman, come back over and over again. And what's the easiest way to get a patient to come back? Get them hooked on a narcotic painkiller.
Oh, yes.
Brian?
Oh, yes. It's Beverly Hills, Beverly Pills, because in Beverly Hills, it's a pill mill. And you've got doctors who just give these medications over and over again. And you know something, Jane, the prescription medications are so available to people. They are just, it's a flood, it's an epidemic. And if we can remember one thing, in the Anna Nicole Smith case, people said the doctors are going to learn. After about a month or two, they shrugged their shoulders. We forgot. I hope that in the Michael Jackson case, we do not forget. If there's one legacy of this case, I hope it is, don't forget that these pills kill and that Michael Jackson died unnecessarily.
And it's not just superstars. I mean, that's the thing. Tanya, it's all over the country. As the DA said, it's a leading cause of death beyond car accidents in some states. We've got 4 seconds, but just your reaction to that aspect.
Yes, drug use and drug abuse is rampant, and this should put the doctors on notice that we're not going to allow these type of deaths to come upon us again.
On the other side, fans.
Was Michael Jackson savable when Dr. Murray found him? Is that what you're asking me?
Yes.
Yes.
Sounds like he had substance abuse problems, and you're providing this environment where drugs are readily available. That is definitely a foreseeable complication.
Absolutely. When you give propofol, you have to always assess the sedation level, and you do not leave a patient unmonitored. It's like leaving a baby that's sleeping on your kitchen countertop.
Extreme is when this is just something that we just would never expect to see.
In either scenario, Conrad Murray played a direct role in causing Michael Jackson's death.
Why would I talk on the phone? I would wake Mr. Jackson up.
Would it be strange for Dr. Murray to call you in the event of emergency at the house?
Yeah, if Mr. Jackson's dying, it would.
It makes logical sense to call 911. He doesn't have any of the appropriate equipment, any help. He needs to get help. You call 911 first. Because he obviously, waiting didn't work.
Dr. Conrad Murray, guilty of involuntary manslaughter in the death of the king of pop, Michael Jackson. Moments after the jury announced their verdict, Dr. Murray was handcuffed and hauled off to jail, where he will stay until sentencing day, which is November 29th. Jackson family members and fans praised the prosecution for putting on a stellar case, and this was their star witness, Dr. Steinberg.
When you monitor a patient, you never leave their side, especially after giving propofol. It's like leaving a baby that's sleeping on your kitchen countertop.
Joining me now in an Issues exclusive is that star witness for the prosecution, cardiologist Dr. Alon Steinberg. Dr. Steinberg, this is the first time you are talking about this case, about this extraordinary trial, about your testimony that most people conclude is what put Dr. Murray away, because you took extremely complicated medical testimony and you boiled it down to people terms that the jury and, by extension, those watching at home could understand. Your reaction, first of all, to this verdict?
Well, I think the jury decided the right thing and the proper thing. So I'm happy that my testimony helped out in convicting Dr. Murray.
What do you think this says to the Dr. Feelgoods of the world, the ones who are doing medicine as a money-making enterprise as opposed to a calling?
I think most doctors are doing it for a calling. I think that's a rare doctors of what Conrad Murray does. I review a lot of cases for the Board of California, and I've never seen such a extreme deviation from the standard of care. But I think it's actually a win for patient safety, but also a win for doctors. It just puts us on notice that we need to practice within the right boundaries of medicine. And it's already helped me in practice. Sometimes, just as you said, patients get medications from multiple doctors. I'm a cardiologist, but sometimes patients say, hey, you know, ran out of my Ambien, I don't have a follow-up with my primary for a while, or my back hurts, I need some Percocet. And this gives me some ammunition. So, you know, you really need to seek a specialist in that part of your medical care.
Michael's dermatologist, Dr. Arnie Klein, believes that Michael Jackson was totally addicted to propofol. Listen to this.
So he had problems with the propofol many times that I intervened, and I told him it was terribly dangerous, and he just had to stop.
If anyone at home wants to see more of Dr. Klein's exclusive interview, and I'm not choked up over his interview, believe you me, but you can go to HLNTV.com. Dr. Arnie Klein said that he thought Michael Jackson was totally addicted to propofol, that he had tried to do 3 interventions. Dr. Steinberg, that means that other doctors out there were giving Michael Jackson propofol, that Dr. Conrad Murray wasn't the only one. Does that horrify you?
It's really scary. And part of that probably set up why Dr. Murray used it, because Michael Jackson knew so much about it. He said, oh, all these other doctors gave it, it's not a big deal. And it probably helped convince Dr. Murray to, you know, do it also. In fact, in his testimony, there was another doctor that basically showed and taught Conrad Murray about how to give it overnight and used his office initially. And then Conrad Murray more or less learned how to do it and continued to do it, thinking it's not a big deal because all these other doctors are doing it. But as my mother said, just because everyone's jumping off a bridge, you shouldn't.
But does it scare you? I'm kind of scared that there are doctors out there, not just one, but more of them, administering propofol.
I don't think so. I think this was a very, very unique situation.
No, hold on. If somebody is doing 3 interventions on propofol, okay, that means that doctors, more than one doctor, is giving Michael Jackson propofol for the wrong reasons as a sleep aid. And he's getting this at different times, so it's different doctors.
You can pay a lot of money.
Me. Does it scare you?
You know what? I'm out there. I see physicians in my community. I review cases for the board. I've never heard of a case like this. This was really egregious. I want to assure you that, you know, most doctors, all doctors almost, are moral and have a high standard of ethical care. This was just an extremely unusual case, so I want to reassure you that I don't think that will happen. But, you know, in any profession, there's some outliers, and money and fame can sometimes buy anybody.
What was your most nerve-wracking moment on the stand?
I didn't have too much of a nerve. I prepared for the direct examination with David Walgren, and I prepared for the cross, and there wasn't a question that came at me that I didn't know was going to come at me.
So you weren't nervous?
I was very nervous before I came in, but I just thought of myself on a beach and laying around, and I walked in, and I knew most of the questions that were going to come at me, at least initially. So once I got a few questions out, I was very relaxed.
All right, well, let's listen to what defense attorney Ed Chernoff said during closing arguments about some of the things that you said, Dr. Steinberg. Check this out.
It was the most insulting possible thing you can say about Michael Jackson. As if this fully formed 50-year-old man was just a baby.
How much time? All right, you heard Ed Chernoff there.
Yeah, he took it out of context. What I was trying to show is that he was almost like a baby, like he was in a complete, utter no control. You know, because he was under the influence of propofol. So it was like leaving a baby on a table. I didn't mean to call him like he was, you know, not an adult. I just meant that under Dr. Murray's care, it's like a parent to a small child. And leaving him on the table is like leaving a guy on a propofol and going to the bathroom a few minutes. It's just like the chance that you're going to leave your baby there and they're going to be sleeping and he may fall off.
Were you shocked when you heard what Dr. Conrad Murray had done by his own admission?
It was amazing. When initially I got the case, I got a lot of information. I got, you know, the phone calls and the ambulance report and the doctor's report and the interviews. But the only thing I did on my report is actually look at the interview that he did with the detectives a couple days afterwards. And when I read that, I said, all the information is right there in his own words. And all I did in my report was just on that testimony or investigation, and that was enough.
Were you shocked by what he did?
I was really shocked. I couldn't believe it. I'm sometimes a little embarrassed that a physician would do that because it makes physicians look bad. But it was just unbelievable.
Of all the things he did, what was the most shocking thing that he did, in your opinion?
Wow, you know what? The most shocking thing, I think, is just not calling 911. I mean, holy cow. I mean, that's just the basics. When you don't have any help at all, and you're in someone's home, and you know that you don't have the proper equipment, you're not monitored, he's going to be in trouble if you don't get him intubated on a respirator. You got to call 911 immediately and get help.
Do you think if Dr. Murray had called 911 immediately, Michael Jackson might still be alive?
There was a lot of things. Yes. One, if he would have called 911 immediately, they were only about 4 minutes away. He had just found that he at least states he was only gone for about 2 minutes. He would have gone over, the EMS would have gotten there and probably resuscitated him because he found him with a blood pressure and he just stopped breathing. So when we put people to sleep all the time, people sometimes stop breathing, and we are able to resuscitate them. But if we can't do it, we have a call button that calls people immediately to come and help us. He's in someone's home. He needs to call 911 immediately. But there's a lot of things, Jane. Also, if he would never have given propofol, never provided it, Mr. Jackson would be alive also. If he would have had any monitoring, would not have left his side, or had an assistant, he would still be alive. If he had the proper equipment there or some drugs, he would be alive. And if he would have even responded to the resuscitation himself, before he even called 911, he tried to revive him by using mouth-to-mouth. And we don't use mouth-to-mouth when we have a bag mask. We use oxygen and with an Amvo bag, and we try and push the oxygen into a patient to increase their breathing. You know, he didn't do that. He started doing chest compressions on someone who had a circulation. He had a pulse. On the pulse oximeter, there was a heart rate. He was nice and warm when he found them, and the fact that he started doing chest compressions was a complete waste of time and counterproductive. So there were so many things that each one of those things, I feel Michael Jackson could have still been alive.
Wow. So really, he could have been here today if he had done any of those things.
I think absolutely. One is providing the propofol was horrible, and his actions were just inappropriate. He panicked.
Thank you so much for joining us, Dr. Steinberg. So delighted to speak to you. There you go. First time Dr. Steinberg is speaking. Supporters sounded off outside court today. What did you think about the guilty verdict? Give us a call. We're taking them. 1-877-JVM-SAYS.
We waited for over 2 years for this, and we all just want justice for Michael so bad, so